Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Sepsis. Introduction. Sepsis is a life-threatening complication of an infection. Babies, elderly people, and those with weakened immune systems are most likely to get sepsis, but even healthy people can become ill from it. Most people with mild sepsis will recover, but sometimes sepsis can turn into septic shock. About 40% of people with septic shock die from it. Early treatment is crucial. This program explains sepsis. It discusses the symptoms and causes of the illness as well as treatment options. The immune system. The immune system is the body's natural defense system. It is a complex network of cells, tissues, and organs that work together to defend the body against germs. The immune system protects you from disease and infection. The immune system helps your body recognize potentially harmful germs. These germs can include bacteria and viruses. The job of the immune system is to attack and destroy substances that it recognizes as foreign. Foreign substances are different from the body's normal, healthy tissues. If your immune system cannot do its job, the results can be serious. People with weakened immune systems are at risk for infections. The immune system can be weakened by aging, exposure to chemotherapy, radiation, or chemicals, certain illnesses such as HIV, AIDS, diabetes, or cancer. Causes. Sepsis can be caused by many different germs. Usually bacteria are to blame, but sometimes sepsis results from a viral or fungal infection. People in the hospital are more likely to develop sepsis than other people. Those in the intensive care unit have an even higher risk of infection and sepsis. Any type of infection can lead to sepsis, but it is most often caused by infections of the abdomen, bloodstream, kidneys, lungs. Sepsis is more common and more dangerous in older adults, babies, and people who are very sick. People who rely on medical devices such as IV lines and those with a compromised immune system also have a higher risk of developing sepsis. Burns, injuries, and wounds also increase the risk. Many types of bacteria can resist the effects of antibiotics that once killed them. These antibiotic-resistant bacteria are often the cause of the infections that trigger sepsis. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Symptoms. Signs and symptoms of sepsis may include a confirmed or suspected infection, low blood pressure, fast heart rate and breathing, confusion or restlessness, problems with organ function, fever, chills, or shivering. Sometimes sepsis can cause a red rash on the skin or small red dots over the whole body. Sepsis may also cause joint pain in the ankles, back, elbows, hips, knees, wrists. An infection, along with fast breathing, low blood pressure, and changes in mental status, could be signs of sepsis. Contact your healthcare provider right away if you or someone else has these signs. If the person had a recent surgery or hospital stay, seek medical care right away. Complications. Sepsis can lead to organ damage and even organ failure. It can also cause tissue death, called gangrene. Having sepsis puts you at a greater risk of getting it again. Septic shock is a complication of sepsis. It happens when blood pressure drops dangerously low. If you have sepsis, you will be monitored in the hospital for signs of septic shock. While most people recover after having mild sepsis, about 40% of people who get septic shock die. Diagnosis. There are 3 warning signs that help your healthcare provider diagnose sepsis. A change in mental status, such as confusion or restlessness. Systolic blood pressure lower than 100 mmHg. Breathing faster than 22 breaths per minute. Your healthcare provider may order blood tests and testing of mucus or fluid from the lungs, fluid from wounds, urine. Your healthcare provider may also order X-rays, a CT scan or computed tomography scan, an MRI or magnetic resonance imaging, an ultrasound. Healthcare providers diagnose septic shock if medications are needed to keep blood pressure at or above 65 mmHg. There is too much lactic acid in the blood after being given fluids. This means that the body isn't using oxygen well enough. Treatment. Sepsis is a medical emergency. People have a better chance of survival if given treatment early. You may need to be monitored or treated in the intensive care unit or ICU if you have severe sepsis. You may need breathing and heart support to keep you alive. Many medicines are used to treat sepsis. They can include antibiotics, medications called vasopressors to increase blood pressure, corticosteroids to reduce inflammation, insulin to keep blood sugar levels stable, painkillers, sedatives. Once you are diagnosed with sepsis, treatment with antibiotics begins right away. Your healthcare provider will give you an antibiotic that is effective against a variety of bacteria. Antibiotics are given through a vein or intravenously. After determining the type of infection, your healthcare provider may then start you on a different antibiotic tailored to fight the specific bacteria that you have. You may be given intravenous fluids. If your blood pressure is still too low, your healthcare providers may give you vasopressors to narrow your blood vessels and raise blood pressure. People with severe sepsis usually receive supportive care. You will probably receive oxygen either by a tube that is placed near the nose or through a clear plastic mask. Large amounts of intravenous fluids may also be given. You may need dialysis to treat kidney failure. You may also need a machine to help you breathe. In some cases, you may need surgery to remove a pocket of pus called an abscess or another infection.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Sepsis is a life-threatening complication of an infection. Usually bacteria are to blame, but sometimes sepsis results from a viral or fungal infection. Sepsis is more common and more dangerous in older adults, babies, and people who are very sick. People who rely on medical devices such as IV lines and those with a compromised immune system also have a higher risk of developing sepsis. Burns, injuries, and wounds also increase the risk. Signs and symptoms of sepsis may include a confirmed or suspected infection, low blood pressure, fast heart rate and breathing, confusion or restlessness, problems with organ function, fever, chills, or shivering. Sepsis can lead to organ damage and even organ failure. It can also cause tissue death called gangrene. Having sepsis puts you at a greater risk of getting it again. You may need to be monitored or treated in the intensive care unit or ICU if you have severe sepsis. You may need breathing and heart support to keep you alive. Sepsis is a medical emergency. People have a better chance of survival if given treatment early. Thank you for using Explain.